If we are to believe that endurance is a virtue, then surely the monthly marathon of a cramped uterus deserves its own gold medal, or at the very least, a very long nap and a heating pad that never goes cold.
Please hit that subscribe button and turn on notifications. You won't want to miss what's coming next. Check the description for trusted sponsors and ways to support the show. Welcome to the Wellness Lab Digest. I'm Hayes, and I'm joined by Vince. Today, we are tackling a subject that is often whispered about but rarely explained with the clinical and emotional depth it deserves. We are talking about dysmenorrhea, the clinical term for menstrual cramps. This isn't just a period talk. This is a conversation about pain, systemic medical bias, the incredible resilience of the human body, and the profound, often invisible impact it has on the lives of millions.
I'm here to listen and learn today, Hayes, because even though I don't experience this personally, the data on how much this impacts the workplace, school, and general quality of life is pretty staggering. It seems like this is one of those health issues where the lived experience of the patient and the clinical response from the medical community, or pain gap, are often miles apart.
That is exactly where we need to start, Vince. The pain gap isn't just a catchy phrase. It's a documented phenomenon where women's pain is taken less seriously by healthcare providers compared to men's pain. Let's look at the numbers first to ground ourselves in the scale of the issue. Depending on which study you look at, between 50 and 90% of reproductive age women experience dysmenorrhea. About 15 to 20% of those women describe the pain as severe enough to interfere with their daily activities. In the United States alone, we are talking about 600 million lost work hours every single year. 600 million! When we talk about menstrual cramps, we aren't just talking about a minor inconvenience. We are talking about a biological event that, for many, is incapacitating. In fact, a study from University College London suggested that the pain can be as severe as a heart attack. Yet, how many people are told to just take an aspirin and keep moving during a heart attack? Can you imagine going to work while having a mild heart attack every month?
I was reading about the way pain is actually measured in clinical settings. We often use the visual analog scale, that line from 0 to 10. But I think it's important to talk about what those numbers actually mean in the context of a cramp.
A 7 on the pain scale for someone with severe dysmenorrhea isn't just uncomfortable. It's the level of pain where you cannot focus on a conversation. It's the level where your body starts to produce cold sweats. It's the level where your vision might start to tunnel. When researchers compare this to other conditions, they find it maps closely to the pain of early-stage active labor or the ischemic pain of a heart attack. If you saw someone in a restaurant experiencing the symptoms of a heart attack, you would call an ambulance. But if a woman experiences that same level of physiological distress in her cubicle, she's often expected to just finish her spreadsheets.
Why is the heart attack comparison so accurate? I think we should really break down that ischemia concept you mentioned earlier. It's a word most women don't associate with their period.
It's the most important word in this whole episode, Vince. Ischemia. During menstruation, the body produces prostaglandins, specifically prostaglandin F2 alpha. These are chemical messengers that tell the uterus to contract to help shed the endometrial lining. Now, in a normal cycle, these contractions are gentle and rhythmic. But in dysmenorrhea, the levels of these prostaglandins are through the roof. The contractions become so powerful, sometimes exceeding 120 millimeters of mercury, that they actually exceed the blood pressure in the arteries supplying the uterus.
So the uterus essentially squeezes its own blood supply shut.
Exactly. The blood stops flowing, oxygen stops arriving, carbon dioxide and lactic acid start to build up in the muscle tissue. This triggers the pain receptors, the nociceptors, to send a high-priority alarm to the brain. This is exactly what happens in the heart muscle during a myocardial infarction. The tissue is starving. It is a biological emergency.
When you explain it like that, the toughness required to walk around with ischemic tissue for 3 days is mind-blowing, and yet for centuries we didn't even acknowledge it was physical. I was looking into the Victorian era's take on this.
Oh, the Victorian era was a nightmare for women's health. At that time, it was widely believed that women's bodies were inherently fragile and that any intellectual pursuit would divert blood away from the uterus, causing congestive pain. They literally blamed education for cramps. Then we moved into the Freud era, where pain was rebranded as a psychological rejection of the feminine role. Essentially, doctors were saying, if it hurts, it's because you don't want to be a mother. It wasn't until the 1970s, when we finally identified the role of prostaglandins, that the medical community had to admit it was a biochemical reality.
But even with the biochemical reality, the normalization persists. I think about the stories we've received from our listeners. We have women in high-pressure jobs, pilots, surgeons, athletes, who are managing this ischemic event while being responsible for the lives of others.
We heard from a listener named Chloe, an emergency room nurse. She wrote to us saying that she has spent shifts literally leaning against the wall in the trauma bay, trying not to pass out from the pain, because she was afraid that asking for a break for period cramps would make her look weak or unprofessional to her male colleagues. We heard from another listener, a professional cellist, who had to develop a specific way of sitting and breathing just to get through a 2-hour performance without her hands shaking from the pain-induced adrenaline spike. This leads us to a crucial point about systemic exhaustion. When your body is fighting this battle every month, the ischemia, the adrenaline, the massive inflammatory spike, it takes a huge toll on your cellular health. It's not just about the pain in the moment, it's about the recovery.
That's a profound point, Hayes. If you have a heart attack, the recovery period is weeks or months under strict medical supervision. But with dysmenorrhea, the recovery period is usually just the next Monday morning. Your body is left trying to repair damaged tissue and clear out cellular debris while you're back at work. This constant state of emergency repair is exhausting. It drains your body's natural resources, particularly its master cells that are responsible for systemic renewal.
Exactly. When your body is perpetually in recovery mode, it can't focus on optimal health. This is why we are such advocates for supporting the body's natural repair mechanisms at a foundational level. When we talk about cellular repair, we are really talking about stem cells. These are the building blocks that migrate to areas of stress or injury to restore function. If your body is constantly depleted by inflammatory cycles, you need to support those master cells. This is where StemActive comes in. StemActive is a premium, USA-made stem cell activator designed to help your body regain improved function.
By utilizing rare, clinically studied ingredients like Madagascan aloe macroclada and Tibetan sea buckthorn, StemActive helps increase the number of circulating stem cells in your bloodstream. These aren't just vitamins. They are precursors that support your body's innate ability to renew its own tissues. Whether you're recovering from a grueling workout, the natural aging process, or the monthly toll of high prostaglandin inflammation, StemActive provides the cellular support you need to bounce back rather than just getting by. It's vegan, gluten-free, and backed by a full money-back guarantee. If you want to stop the cycle of depletion, scan the QR code on your screen or click the link in the description. Now, Hayes, let's talk about the mind-body component of the protocol, because the brain is the one that has to process all this emergency data from the uterus.
I'm glad you mentioned the brain, Vince. There is a concept called neuroplasticity that plays a huge role in chronic pain. When the brain receives pain signals month after month, year after year, it becomes more efficient at processing those signals. It's like a well-worn path in the woods. This is why some women find their cramps get worse as they get older. Their nervous system has become sensitized to the pain.
So, meditation and mindfulness aren't just about relaxing. They're about repaving those neural pathways.
Exactly. Mindfulness-based stress reduction, or MBSR, is about teaching the brain to observe the sensation of the contraction without the fear layer on top of it. When we fear the pain, our body produces cortisol and adrenaline. Those hormones cause vasoconstriction, which, as we know, makes the ischemia worse. By using meditation to stay in a parasympathetic state, we can keep the blood vessels as open as possible, even during a contraction.
What about the physical tools? We talk about the heating pad, but I think there's more to it than just a warm blanket.
The thermal protocol is actually quite specific. You want continuous low-level heat. Studies have shown that applying a heat wrap for 8 hours a day can be more effective than taking the maximum dose of over-the-counter painkillers. Heat increases the elasticity of the uterine muscle and dilates the blood vessels, directly fighting the ischemic cause of the pain. It's a bottom-up approach to pain relief, whereas meditation is a top-down approach. You need both.
And let's talk about the chemical side of the protocol, magnesium and ginger. These are favorites in our community.
Magnesium is the nature's muscle relaxant. It competes with calcium at the cellular level. Calcium causes muscles to contract, magnesium helps them relax. Many people who suffer from severe cramps have low intracellular magnesium. Taking a high-quality magnesium glycinate supplement for the 7 days leading up to your period can significantly dampen the intensity of those prostaglandin-driven contractions.
And ginger? I remember you saying it's a prostaglandin inhibitor.
It is. Ginger is a natural COX inhibitor, much like ibuprofen. It blocks the enzyme that produces those inflammatory prostaglandins. In some head-to-head clinical trials, 250 milligrams of ginger powder was found to be just as effective as 400 milligrams of ibuprofen for menstrual pain relief, but without the risk of irritating the stomach lining.
Now, I think it's time we address the master FAQ we've developed. We've gone through thousands of comments and clinical questions to provide the most comprehensive answers possible.
Question: why do I get period poops and digestive issues alongside my cramps? This is one of the most common questions, and it's all down to those prostaglandins. They don't just stay in the uterus, they leak into the bloodstream and travel to the smooth muscles of the intestines. Just as they make the uterus contract, they make the bowels contract. This leads to hypermotility, which is a fancy way of saying everything moves through your system way too fast. It's a sign that your prostaglandin levels are very high and systemic. Focusing on anti-inflammatory protocols like ginger and omega-3s can help reduce this crosstalk between your organs. Question: is it normal for my cramps to radiate down my legs and into my lower back? Yes, unfortunately, this is very common. The nerves that supply the uterus also share pathways with the nerves that go down the legs and into the lumbar region of the back. This is called referred pain. When the uterine pain is intense enough, the brain has trouble distinguishing exactly where it's coming from, so it feels like your whole lower body is under attack. Gentle stretching and using heat on the lower back can help confuse the pain signals and provide some relief. Question: does my caffeine intake really make a difference? Caffeine is a vasoconstrictor. If you are already experiencing ischemia, muscle tissue being starved of oxygen because the blood vessels are squeezed shut, adding a vasoconstrictor like caffeine is like throwing gasoline on a fire. It further restricts blood flow. Many women find that if they cut out caffeine for the 3 days before and the first 2 days of their period, their pain levels drop by 20 to 30%. Question: is it true that I should avoid cold water or cold foods during my period? In many traditional Chinese medicine practices, cold is seen as a factor that causes blood to stagnate. While Western medicine doesn't use the same terminology, we do know that cold temperatures cause vasoconstriction. Drinking ice-cold water or being in a very cold environment can cause the body to shunt blood away from the extremities and the pelvic area to keep the core warm. This can exacerbate the ischemic pain. Sticking to warm liquids, like herbal teas or room temperature water, is a simple way to support vascular health during your cycle. Question: why do I feel so depressed or anxious right before the cramps start? This is the neuroendocrine connection. The same drop in progesterone that triggers the period also causes a drop in serotonin, your feel-good neurotransmitter. Furthermore, high levels of inflammation, which characterize the start of the period, are directly linked to mood shifts. Inflammation in the body often leads to neuroinflammation in the brain. Supporting your body with anti-inflammatories and magnesium doesn't just help the physical pain, it helps stabilize the chemical environment in your brain. Question: what is the red flag list for when I should stop self-treating and see a doctor? This is the most important question. If your pain is so severe that you are vomiting or fainting, that is a red flag. If your pain lasts more than 3 days, that is a red flag. If you have deep dyspareunia, which is pain during intercourse, that is a major red flag for endometriosis. If your period is so heavy that you are soaking through a pad or tampon every hour, you need to be checked for fibroids or adenomyosis. Do not allow a healthcare provider to tell you that being a woman is just hard. Demand an ultrasound and a specialist referral. Question: does the seed cycling protocol actually work? Seed cycling, eating flax and pumpkin seeds in the first half of your cycle and sunflower and sesame seeds in the second half, is a popular holistic tool. While large-scale clinical trials are still lacking, the principle is sound. These seeds provide the specific fatty acids and lignins that help the body metabolize estrogen and produce anti-inflammatory prostaglandins. It's a low-risk, high-reward lifestyle integration that supports the foundation of your cycle. Question: how does stress at work affect my period cramps? Stress activates the HPA axis, the hypothalamus-pituitary-adrenal axis. This increases cortisol. High cortisol steals the precursors needed to make progesterone, leading to a state of estrogen dominance. Estrogen is what builds up the uterine lining. The thicker the lining, the more prostaglandins are produced to shed it. So, a high-stress month literally leads to a more painful period. This is why the mindfulness and meditation protocol isn't just a luxury. It's a biological necessity for hormonal balance. Question: can acupuncture help with dysmenorrhea? Yes, there is significant evidence that acupuncture can reduce the intensity of menstrual pain. It is believed to work by stimulating the release of endorphins and by modulating the way the nervous system processes pain signals. It also appears to improve blood flow to the pelvic organs, which directly addresses the ischemia. Question: is it safe to use a TNS machine for period pain? A TNS, or transcutaneous electrical nerve stimulation, machine uses low-voltage electrical currents to treat pain. It works on the gate control theory of pain. By sending a constant, tingling electrical signal to the brain, it closes the gate to the slower, sharper pain signals coming from the uterus. It's a fantastic non-drug tool that many women find very effective for active management. Question: why do I get so bloated right before the cramps? Bloating is caused by an increase in the hormone aldosterone, which tells your kidneys to hold on to water and salt. This is also driven by the drop in progesterone. This extra fluid increases the pressure in the pelvic cavity, which can make the sensation of cramping feel even more heavy and intense. Reducing salt intake and increasing potassium-rich foods like bananas or spinach during your luteal phase can help manage this fluid shift.
Hayes, we've covered a massive amount of ground here, from the Victorian era to the cellular biology of stem cells to the gate control theory of TENS machines. If someone is listening to this and feeling overwhelmed, how do we distill this into a daily life protocol?
It's about the 3 pillars, Vince. Pillar 1 is the foundation. This is what you do every day of the month. You eat the anti-inflammatory fats, you practice 5 minutes of mindfulness, and you keep your magnesium levels topped up. This builds a body that is less reactive to inflammation. Pillar 2 is the luteal window. This is the 7 days before your period. This is when you cut out the caffeine, you increase your ginger intake, you focus on warm foods, and you prioritize 8 hours of sleep. You are preparing for the marathon that is coming. Pillar 3 is active mitigation. This is the first 48 hours of your cycle. This is when you use continuous heat. You use your TENS machine or meditation to close the gate on the pain signals, and you allow yourself to move at a slower pace. You treat your body with the same care you would if you were recovering from a minor injury.
I love that. It takes the shame out of the experience and replaces it with strategy.
And that strategy is what gives you your power back. We want to thank everyone who shared their stories with us for this episode. Your vulnerability is what helps us break the stigma and demand better science for all of us. If you've been suffering in silence, please know that you are seen, your pain is real, and there are tools out there that can help. You don't have to do this alone.
It's been an absolute privilege to go this deep with you today, Hayes. I feel like we've really scratched the surface of what's possible when we take women's health seriously.
Thanks for tuning in to the Wellness Lab Digest. If this episode inspired you, here are 3 quick ways to support the show. 1. Subscribe so you never miss fresh, body-loving wellness insights. 2. Share this episode with someone who needs it today. 3. Comment below and tell us what topics you'd love to hear next. Want to do even more? Check the description for ways to support the show. Stay curious, stay well, and we'll see you in the next episode.